Today at the FIP Congress, there's been a forum on women in pharmacy, and I have here with me Ann Keeling, Senior Fellow at Women in Global Health. Ann, can you tell me why your organization, Women in Global Health, is needed right now?
So Women in Global Health campaigns for gender equality in global health and campaigns for women's leadership in global health. Women are 70% of the global health workforce, but only 20% of decision makers. And that's really the reason why our organisation is needed. Global health is basically flying on one wing. It's not using all the available talent that could be in those decision-making jobs. And also the people who know most about the health systems that they run are not in a position to influence the shape of those systems and the delivery. So that's really why we exist.
And you also work for the World Health Organization's Equity Hub, of which FIP is a partner. Can you go tell us a little bit about what this initiative is about?
Yeah. So the Gender Equity Hub, which is co-chaired by the WHO and Women in Global Health, is part of a much, much bigger initiative on the global health workforce. We're just the part that deals with, as far as I'm concerned, the most important issue, which is gender equity. And there we're looking at all the barriers to gender equity in the health workforce. And when I'm talking about gender, I'm talking about all genders, and I'm talking about people everywhere. And we know that the situation in low-income countries, for example, is very different from the situation in high-income countries. So we're looking at the moment at the barriers to entry and to decision-making positions that women have. But we're also looking at occupational segregation. Why nursing, for example, globally is about 95% female. How can we get gender equity in nursing, for example? And the world needs to fill about 40 million new health worker jobs by 2030 to reach universal health coverage. And in particular, we need to create 18 million new health worker jobs in low-income countries. Low-income countries still have the greatest burden of disease. If we look at Africa, Africa has 24% of the global burden of disease, but only 4% of the world's health workers. So we desperately need to even up supply and demand of health workers, create new health workers everywhere, but particularly look at what's going on in low-income countries.
And so what could the pharmacy workforce team learn from the gender equity trends across the whole healthcare workforce?
Well, given that we have such an urgent need to create so many jobs, and it's not possible to create that many jobs, that simply isn't going to happen. We need to be looking across the health workforce, and pharmacists play a critical role in that, often out there at the front line, dealing with customers, dealing with caregivers. So we need to be dealing with this as a coalition and considering all the resources that we have in global health. And that will include paramedics, it will include traditional midwives, looking at how we can shift tasks between one part of the health system and another. And I think we've already seen pharmacies taking on, a lot of different roles, looking at some aspects of primary care for non-communicable diseases like diabetes, vaccinations in certain countries. But we need to look at all the resources that we have in health and work out how we're going to shift what needs to be done.
And lastly, what are the main topics or main issues that need to be discussed around this topic, given that for a large majority of countries, most of the professionals are women?
We need to be looking at how we can ensure that the jobs that we have are decent work. So it's not going to be about just putting more women into the type of jobs that they have now. Because a lot of women in the health workforce are on insecure conditions, they're unpaid, they're on very poor contracts, they don't have maternity leave. There are just so many labour rights that a lot of the women in that workforce don't have, which leads to attrition, but it also leads to them not being as productive as they could be. So when we're talking about bringing more women into the health workforce, we're also looking at investing in women and investing in better formal jobs for women, bringing women who are now in the informal or unpaid market into the formal paid labour market, which will have a huge spin-off for health, for gender equality, and for economic growth in general.
Absolutely. Well, thank you so much.
Okay.
This is Whitley Yee at FIP Congress in Glasgow.